Hello everyone, welcome back to another video on our channel. Today we're diving deep into a crucial topic for our health, colon cancer. But what exactly is colon cancer? This type of cancer affects the colon, the final part of the large intestine, and is one of the most common forms of cancer in the digestive system. Annually, thousands of people are diagnosed with colon cancer worldwide, and understanding its signs and symptoms can be crucial for early diagnosis and effective treatment. Colon cancer is a type of cancer that occurs in the colon, the longest part of the large intestine. Often, it begins as small, benign clusters of cells known as polyps. Over time, some of these polyps can transform into colon cancer. The process is often slow, occurring over several years, which underscores the importance of regular screenings, such as colonoscopy, that can detect and remove polyps before they become cancerous. The causes of colon cancer can include genetic factors, lifestyle, age, and pre-existing health conditions. Risk factors include a diet high in fats and low in fiber, sedentary lifestyle, obesity, smoking, and excessive alcohol consumption. People with a family history of colon cancer or inflammatory bowel diseases, such as Crohn's disease or ulcerative colitis, are also at higher risk. Remember, information can be your greatest ally in preventing and combating this disease. So, stay with us until the end, take note of the tips, and if you think this video can help someone, be sure to share it. Number 1. Changes in bowel habits. One of the earliest and most common warning signs of colon cancer are changes in bowel habits. But what does this really mean? We're talking about significant and persistent changes in the frequency, consistency, or shape of the stools. For example, you may start to experience diarrhea or constipation that lasts for several weeks, or even alternate between these two extremes without an apparent cause. It's important to note that while everyone may experience occasional intestinal issues, persistent or severe changes require special attention. These changes can be accompanied by discomfort or abdominal pain, which could be a sign that something abnormal is happening in the colon, such as the growth of a polyp or a tumor. Why does this happen? Well, as a tumor grows, it can affect the way the colon functions. The tumor may partially block the colon, impacting how content moves through the intestine, or it can alter the nature of the surrounding tissue, affecting the consistency of the stool. That's why paying attention to these changes is crucial. Do not ignore the signals your body is sending. Number 2. Blood in the stool. The second alarming sign we're going to discuss is the presence of blood in the stool, a potentially serious indicator of problems in the gastrointestinal tract, including colon cancer. The blood can appear in various forms. You might notice spots of bright red blood, or in some cases, the stools may have a darker, almost black color, indicating the presence of digested blood. Why is this concerning? Blood in the stool can be a sign that a tumor is causing bleeding within the colon or rectum. As the tumor grows, it may ulcerate or invade blood vessels, leading to this visible bleeding. It's important to emphasize that, while it's not always cancer, hemorrhoids, anal fissures, and other benign conditions can also cause bleeding, it's crucial to take this symptom seriously and seek medical evaluation. When you notice blood in your stool, it's essential not to try to diagnose yourself. Consulting a doctor is crucial to perform the necessary examinations, such as a colonoscopy, which can help identify the source of the bleeding. Early detection and treatment are key to improving treatment outcomes, especially if the diagnosis is colon cancer. Therefore, this sign should be taken with utmost seriousness and addressed urgently. Number 3. Unexplained anemia. The third alarming sign that requires medical attention is unexplained anemia, especially when caused by iron deficiency. But how can anemia be related to colon cancer? Let's understand. Iron deficiency anemia occurs when the body lacks enough iron to produce hemoglobin, the substance in red blood cells that allows them to carry oxygen. In the context of colon cancer, this deficiency can be caused by chronic internal bleeding, which is often so slow that it goes unnoticed, except for the gradual impact it has on iron levels and energy. Patients with colon cancer often do not notice the bleeding because it is occult, meaning it is not visible to the naked eye in the stool. This internal bleeding can be a sign of a tumor that is growing in the colon or rectum and is slowly bleeding. Symptoms of anemia can include severe fatigue, paleness, shortness of breath, and weakness. If you are experiencing these symptoms and there is no clear cause, it is crucial to consult a doctor for a comprehensive evaluation. This may include blood tests to check iron levels and other substances, as well as more specific tests like a colonoscopy to directly visualize the inside of the colon. Early detection is essential because if the cause is colon cancer, immediate treatment can be crucial for its effectiveness. Therefore, never ignore unexplained anemia, as it could be a warning sign of a much more serious condition. Number 4. Unexplained weight loss. A warning sign that may indicate the presence of colon cancer is unexplained and significant weight loss. By unexplained, we mean a reduction in body weight that occurs without intentional changes in diet or physical activity levels. But why does weight loss occur in cases of colon cancer? Cancer can alter the way the body uses energy, increasing the basal metabolism, and at the same time, it can interfere with the body's ability to properly process and absorb nutrients from food. Additionally, a tumor in the colon may physically block the intestinal tract, making it difficult to digest or absorb food, which contributes to weight loss. It's important to note that while weight loss alone isn't a guarantee of cancer, when combined with other symptoms such as changes in bowel habits or the presence of blood in the stool, it becomes a significant indicator that should not be ignored. Sudden and unexplained weight loss always deserves a medical investigation, as it can be a sign of various serious health conditions, including cancer. Number 5. Persistent abdominal pain. An alarming sign that warrants immediate attention is persistent abdominal pain or discomfort that doesn't go away. This symptom can be indicative of colon cancer, although it may also be related to various other health conditions. Abdominal pain or discomfort in the context of colon cancer can be caused by the growth of a tumor that presses on the walls of the colon or invades adjacent tissues and organs. This type of pain can vary in intensity and character. It may be sharp, constant, or cramp-like. Additionally, it may be accompanied by other colon-related symptoms such as changes in bowel habits, blood in the stool, or a feeling that the bowel does not empty completely after a bowel movement. It is crucial not to ignore this type of pain, especially if it is new or has recently changed in character. Many people tend to delay seeking medical advice, attributing the pain to less serious conditions like gas or intestinal spasms. However, when the pain is persistent and lacks a clear explanation, it is essential to seek medical evaluation to determine its cause. Medical investigation may include physical exams, blood tests, imaging such as ultrasounds or CT scans, and possibly a colonoscopy to directly visualize the inside of the colon. Number 6. Feeling of incomplete emptying. Another concerning sign that may indicate the presence of colon cancer is the sensation of not completely emptying the bowels after a bowel movement. This symptom is technically known as tenesmus and can be quite uncomfortable and distressing for those experiencing it. But why does this happen? In cases of colon cancer, a tumor may be partially obstructing the colon, creating a physical barrier that prevents the complete passage of stool. This blockage can give the sensation that there is more to be evacuated, even after going to the bathroom. Additionally, the tumor can irritate or inflame the colon wall, causing spasms that create the sensation of needing to evacuate, even when the colon is empty. This symptom is particularly important to note because many people may initially ignore it or consider it just a normal variation of bowel habits. However, if accompanied by other signs such as changes in bowel habits, abdominal pain, blood in the stool, or any of the other warning symptoms mentioned earlier, the sensation of incomplete emptying can be an indication of colon cancer. It's vital that this symptom be reported to a healthcare professional. Doctors can investigate the cause with specific tests, such as a colonoscopy, which allows for the visualization of the inside of the colon and the identification of any abnormalities, such as polyps or tumors, that might be causing this symptom. Number 7. Constant fatigue. The last alarming sign on our list that may indicate the presence of colon cancer is constant and unexplained fatigue. The fatigue associated with colon cancer is not simply the common tiredness after a long day or lack of sleep. It is a form of exhaustion that does not improve with rest and can significantly impact daily quality of life. Why is fatigue so significant in the context of colon cancer? There are several potential reasons. First, the cancer itself can cause fatigue as the body fights the disease. Additionally, if the colon cancer causes internal bleeding, even if not visible, it can lead to chronic anemia. The lack of healthy red blood cells to transport oxygen throughout the body results in a persistent feeling of tiredness and weakness. Additionally, colon cancer can affect the absorption of essential nutrients in the large intestine, contributing to inadequate nutrition and, consequently, more fatigue. This condition is exacerbated if the cancer is in more advanced stages, where the impact on the overall health status can be more significant. Remember, it's important to consult a doctor or qualified health professional about any health and wellness issues before making any changes to your diet or lifestyle. Subscribe to the channel for more information and share this video to help raise awareness about this important topic. See you next time.